How do you rid your body of excess yeast and Candida? It's a good thing to know. Yeast overgrowth. There are many forms of yeast. The most common in the human body is called Candida albicans. And Candida albicans exists in all of us. Everybody has it. And if everything else is equal, doesn't cause any problems for anybody. You won't even know it's there. If, however, the internal balance of your intestines or your gut should change and go awry, then there can be problems. Healthy bacteria, which we often refer to as acidophilus or probiotics, should be plentiful in the intestines. And when they are plentiful, they control the yeast overgrowth all by themselves. The only time that you may have a yeast problem is when you take certain drugs or medications that can destroy the beneficial bacteria in your gut. The first example would be antibiotics. I'm sure many of you have experienced the effect of antibiotics. You take an antibiotic for a week or 10 days or 2 weeks or however long, and it's not very long after that that you've got a vaginal yeast infection, you've got a skin yeast infection, you've got gut troubles because of yeast overgrowth, etc. Because what's happening is that the antibiotics are destroying the beneficial bacteria in the gut and therefore allowing the Candida or yeast to explosively multiply. Some other factors that can, other medications or drugs that can do that in addition to antibiotics would be steroid medications and birth control medications, both of which also can destroy the beneficial bacteria in the intestinal lining. And when that occurs, you're off and running. And if that goes untreated or unaddressed, and at that point, the best way to address that is to take high amounts of probiotics. That's why we always recommend that if you have to take an antibiotic or a steroid drug for any reason at all, take large amounts of probiotics immediately afterwards for at least a week or 10 days. And that will usually rebalance the probiotic levels, and you will not experience the yeast overgrowth. If you should not do that and the yeast would continue to multiply, it is possible that it can escape the intestinal tract and get into the bloodstream and various other places. And that can, over time, create a whole host of different symptoms. And if you think you may have a yeast overgrowth, then you might want to, there are many physicians who now test for that. You can email me at askthedoc@healthyinformation.com, and I can refer you to some sources where you can get evaluations and so forth. But yeast overgrowth is very common. It is so common, in fact, that it is estimated that 1 in 3 women and 1 in 5 men will have a yeast overgrowth situation at some point in their life. That being the case, you would be surprised at how many symptoms that excess yeast overgrowth can cause. And because of that, it's always a good idea, if you have to take an antibiotic, if you have to take a steroid medication, or if you are on long-term birth control medications, please take high amounts of probiotics because they can prevent a more serious yeast overgrowth down the track. This is Dr. Whiting. Take care, stay safe, stay well.